Research has been central to what we're doing since even before we started the Cerebrovascular Surgery and Intervention Center, because we treat very rare conditions for which there isn't really a standard of care. Every condition we treat and almost every patient we treat has to be considered on their own merits. And that means that there's a lot of room for creativity and for open-minded thought about how to best treat a patient.
It's important to acknowledge that many of the things we do are still treating rare patients and rare diseases, and we still need to understand the biology better. And even in the situations where we have lots of good information on a specific type of disease, we can still improve what we're doing to achieve better outcomes.
By doing the research and studying the diseases in our laboratories, we're able to develop the new treatments we use in the hospital. At the same time, by seeing these children that we're so privileged to be able to help take care of, we learn things about these diseases that informs our research so we can push it forward. Some of the research advances that have really impacted day-to-day care, for example, are the biomarkers. Biomarkers are ways to detect and follow disease or response to treatment that allow us insights that we can't get with current technologies.
So sometimes you can use non-invasive techniques, sometimes a blood sample, sometimes a urine sample or a saliva sample, to really evaluate and pick up on diseases very early on.
A lot of what we take care of, particularly with cerebrovascular disease, is how blood vessels grow or how angiogenesis occurs. When you look at basic science things like angiogenesis, sometimes it's a little hard to relate what goes on in a petri dish up in a laboratory to how that might translate into taking care of kids. And yet, through this kind of work, we have been able to understand how this angiogenesis works in stroke conditions. And now we have new forms of surgery that build upon that very technique of blood vessel growth so that we have shorter, safer, and more effective surgeries.
One common theme of many of the cerebrovascular diseases is altered blood flow, whether it's too much blood or blood flowing in the wrong regions or not enough blood flowing to the normal brain. One of the imaging techniques that we use is called 4D flow, and it's an MRI scan, just like many of the other ones, that doesn't require contrast, so it doesn't require a needle or an intravenous access, but it can tell us the flow measurements in many of the vessels as small as about 2 millimeters in size. And you can imagine how powerful that is as a tool.
We found that it's an incredible prognosticator of overall outcome. So it predicts mortality. It predicts whether the baby is likely to have brain injuries on their MRI scan when they're born. And it even predicts whether they're going to meet their developmental milestones at 1 month, at 6 months, and at a year after birth. So it's a powerful predictor, and it really enables you to focus the conversation with parents in a way that we could not before.
One of the core beauties of doing research is the ability to create new treatments. We now do surgery in about a third of the time that we used to be able to do it because of some of these advances in the laboratory. We now have studies that are non-invasive that can help understand the nature of the disease and find cures faster than we were ever able to do before. This is really the holy grail of any research enterprise involved with medicine or clinical care, is to be able to say what we're studying at the bench will ultimately have an impact at the bedside to help save lives.